Hey everybody, it's Dr. Dave, Psychiatry. Thanks for being here on the YouTube channel. Today we're talking about side effects. And the reason we're talking about side effects is one of the reasons that people don't want to take medication, which in fact, if you've got a medical problem, you have to take a medication by definition. That's what we're talking about. In my world of psychiatry, this is not mental if it responds to medicine. So it's a medical problem. If it's a brain chemistry problem, that's what I treat. But still, people are scared what medicine might do to them. So if you've seen other videos that I've done on troubleshooting brain chemistry, you know that I'm going to be talking about medicines that might boost serotonin, that might boost norepinephrine, that might reduce dopamine activity. Those are the big three that we typically work with. And the question at the end, when I get a treatment program for somebody, what I'm looking for, again, in the troubleshooting process, we do one thing at a time. So if a person's got 2 or maybe 3 different problems, I'm going to pick one thing and do it. I'm going to ask them to do a medication trial. They're going to take the medicine, come back and tell them what happened. And the question that I get most frequently is it going to cause side effects? Well, when I give you a medicine, let's talk about what a side effect is. When I give you a medicine, I want it to have an intended effect, a therapeutic effect. I want it to help you. So by definition, a side effect is something that you don't want to have happen. I think when most people ask that question, they're really not trying to split hairs between therapeutic and side effect. They're saying, is something bad going to happen to me? And so I try to get them to think about the side effect. Is something bad going to happen? First of all, if you take a medication and you don't like how you feel, then you have to decide if you're going to continue to take it. Side effects come in 2 forms, mild and severe. A mild side effect, what if you're a little more hungry, a little less hungry, a little dry mouth, a little this, a little that. If you can roll with it and it's not causing a major problem for you, because again, if it's a problem, it's a problem. If it's not a problem, it's not a problem. A mild side effects, most times on medicines, they go away. But if you start a medicine and something bad happens, you have to decide when it's bad enough to call it unacceptable. So this is another area where you have to decide for yourself. You have to raise your hand and say, this is wrong for me. So obviously, if you have terrible stomach discomfort, if you have diarrhea, nausea, feel drunk, drugged, not yourself, sped up, hyper, or if you have other stuff which occurs in medicines that are not necessarily, it happens in other medicines too, like a rash or a fever, some allergic reaction, obviously you stop the medicine. So the simple answer to the question is, if you're having a side effect, is it so bad that you can't take it? So I give patients permission the day that I give the medicine. I say, you don't have to call the office. You don't have to ask me permission. If you don't like how the medicine's making you feel, stop it. The next question is typically, well, can I just stop it? And the answer is yes. If you just started it, you can just stop it. That's not a problem at all. So hopefully that helps people, and that would help you. If you're having questions about, should I take a medicine? Should I try medicine? I'm not sure if I want to do a medication trial. The simple logic is you don't have to commit to taking the medicine if you might have a side effect. I tell people that taking a medicine for a brain chemistry problem is sort of like trying on shoes. If you go to buy a pair of shoes and you go to the shoe store and you walk in, you put a shoe on your foot and you know it hurts and you don't like it, well, you don't wear it out the store, pay for it, and commit to it for a month. No, you take it off and put it back in the box. That's why it's called a trial. You try on medicines the same way that you try on shoes. And you don't avoid wearing shoes because you don't want to have a problem, with your foot trying on the shoe, because if it doesn't fit, you're just going to stop it. That's the attitude that I want people to have with the medication trial. You're not committing to anything. So I don't think there should be any fear in it. Now, you don't want to take a medicine that you don't need. We don't want to just throw stuff at you that doesn't have common sense. But your prescription writer, whether it's me, whether it's family medicine, if it's an MD, DO, nurse practitioner, PA, your prescription writer, if they're offering you something that's reasonable and you've accepted the possibility that the benefit will outweigh the risk and you just want to try it, then you should. And you shouldn't not get a medication trial out of fear of side effects. I think the other thing that happens, and this is a modern thing that scares people about medicines, you've probably seen on television the advertisements that say, okay, well, this medicine, I'm not going to pick one because I can't remember the names, but just call it medicine ABC. And the first part of it is a person that's there and you see them on the swings or jogging or whatever. And this might help with your blank or your blank or your blank. And they give you all the positive. And then they say things like, well, you may experience nausea, vomiting, dry mouth, dry heaves, any number of shortness of breath, stroke, blood clot. They list all these things that are scary. And my kids joke, if you have experienced, they say, call your doctor. My kids joke, if you've experienced death, call your doctor, if it kills you. And it's because they put all those scary things out there. Now, the reason they have to do that is, and I have to go back and talk about another thing, a little more detail, which I don't want, but in the 1990s, prior to the mid-1990s, I think it was 1997, it was actually illegal to promote medications directly to consumer, what's called the direct DTC, direct to consumer. You couldn't have an ad for an antidepressant or anti-anxiety medicine or a rheumatoid arthritis medicine or a diabetes medicine. You couldn't directly advertise that because I think probably the government, the FCC, the Federal Communication System, and powers that be said, we don't want you selling these drugs to patients. Well, pharmaceutical industry said, okay, we need to get the word out that we have them available. So they negotiated all that, and somehow it became available. But obviously, without knowing what the negotiations were, the end product is you get a commercial with two aspects. It's got this is how it can help you, and this is how it can mess you up. Now, that's scary for some people, and it's scary enough for some people to say, I don't even want it. I don't want the risk. I don't want to try that. Don't even offer me those things. Well, here's what you need to know. There's this thing called the package insert, which is the FDA approval document for all of my medicines. And it lists all the things that can happen. But it doesn't list all the things that can happen. It lists all the things that they found in their trials. So dry mouth, constipation, little this, little that, blood pressure changes. They list all the things that might happen. What you need to know as a patient is that there's a whole lot of stuff that's not on that piece of paper. I sometimes jokingly say that piece of paper was written by lawyers for lawyers. It doesn't have anything to do with you. What happens to you is what happens to you. You are very specific in your response to medication. So I hope people don't avoid getting the help that they need for depression, anxiety, ADHD, OCD, any of the things that we talk about on this channel out of fear of what might happen. Because the truth is, if you take a medicine once with me and you don't like how you feel, that's all, you're done. You are done. We're not trying to commit you to anything. We're trying to test and see what happens. Because as you know, I've already said this several times in different videos, we don't have a blood test or x-ray for your brain chemistry. How we know what you need is if you respond to a medicine. So if you literally will not take a serotonin booster, I never know if you have a serotonin shortage. If you literally won't take a GABA booster, I don't know if you have a GABA shortage. If you respond well, if you feel better on a GABA booster, that means you had a GABA shortage. If you do better on a serotonin booster, that means you had a serotonin shortage. So that's a troubleshooting logic, and that's what we do every day to help people, and I think that's a common sense way to help people. But if you're scared of side effects, you won't do it. So I think you got to overcome that. You got to understand that all that scary stuff they say on the TV, that's a requirement. And the reality is much more benign. If I give you a medicine, you put one in your mouth, you don't like how you feel, you're done. Don't take another one. It's that simple. Okay? Hope that encourages you. If you're a spouse, a loved one, a parent, and you're nervous about somebody you love or care about taking a medicine over this issue, I hope that this is enough common sense for you to say, look, let's not get in the way of a trial. Because really the equivalent is, it's like we're going to get some shoes. We're just trying on some shoes. That's all we're doing, trying on some shoes. And if they don't fit, we're not walking out the store with them. Okay? Hope this is helpful. Thanks for being on the channel. Hope that you subscribe and like. That helps other people. I'm Dr. Dave. Thanks for coming to see me.